Hi everybody, my name is Dr. Roney. Today's topic is going to be on type 2 diabetes and answering the question, or I'm going to try to answer the question on whether or not this can be reversed. Okay, so before I get started, I'll give you a quick outline. We're going to talk about the types of diabetes. I'm going to go through type 1, type 2, something called type 1.5, which many people are not familiar with, and there's also a type 3 diabetes that I'll talk briefly about. But the focus will be on type 2 diabetes, or insulin-resistant adult onset diabetes. We'll talk a little bit about the mechanisms and what happens with most type 2 diabetics, but we'll also go over some of the more vague mechanisms that could contribute to type 2 diabetes. We'll talk about some stats, and then we'll talk about strategies to be able to help reverse type 2 diabetes. Okay. So first things first, let's talk about type 1 diabetes. Type 1 diabetes is mostly juvenile onset autoimmune diabetes. And what that means is the immune system starts attacking an organ called the pancreas, and the pancreas can no longer secrete insulin properly. So somebody has to be on insulin in order to get glucose from the bloodstream into the cell, which I'll talk a little bit more about. And then we have type 2 diabetes. Type 2 diabetes is also called adult onset or insulin-resistant diabetes. And I'll talk about the mechanisms that contribute to that. And then we have something called type 1.5 diabetes, which means the person starts as a type 2 diabetic, and then because of the inflammatory process and something called immune dysregulation, they basically transition into also type 1 diabetes, which means their immune system starts to attack their pancreas, which then the pancreas won't be able to secrete insulin. So that person can have insulin resistance at the cell, and they could also have autoimmune diabetes. So we're seeing that more and more actually. So the testing and the lab testing can identify that for a person. Okay, and then there's type 3 diabetes, which basically is brain diabetes, and that is a precursor for dementia and Alzheimer's. So many diabetics, unfortunately, if it's not corrected, are, I guess, had a higher risk for dementia and Alzheimer's. So we definitely want to do the best we can to be able to reverse it so they don't get into that neurodegenerative state. Okay, so let's talk about type 2 diabetes and the mechanism. So we have some terms that I want to identify. Number one is glucose, and that's synonymous with sugar, and most of you may know this, but for those of you that don't, I'll stay remedial. And then the other one is insulin. So insulin is secreted by the pancreas when you have glucose or sugar introduced to the body. So the insulin basically piggybacks with glucose, or I should say the glucose piggybacks on insulin, and that allows the glucose or your sugar to get into the cell to be used for energy. So you need insulin in order to get glucose from your bloodstream in cell. So I want to talk briefly about what types of glucose there are, or to simplify it, what foods contain glucose or sugar. And some people aren't that familiar, so I want to break that down. Number one, your fruits definitely contain sugar. Okay, but they also have fiber, which is very good. Your vegetables will contain a small amount of sugar, but what a lot of people don't realize are things like breads and pasta, potatoes, things like that can also have a lot of sugar. So those carbohydrates are converted into sugar or glucose into in the body. So we need to be aware of where our sugar or glucose is coming from. And those, like I said, cakes and cookies and flour products and grains, pastas, potatoes, those are all high levels of sugar that we're not necessarily always aware of. So I wanted to at least make you aware of that. But let's talk about the mechanism. So basically what happens is, in America, there's two main reasons why we're seeing diabetes on an exponential rise. So just going back looking at statistics, in the late 50s, early 60s, maybe 1% of the population had what they call type 2 diabetes. Nowadays, much higher percentage, but also a lot of people have what they call pre-diabetes. And all that means is their numbers of something called the A1C, which is a lab value, is elevated beyond 5.6, okay? It's hard to get into a lot of this right now, but I just want to give you an idea. So pre-diabetes is above 5.6, and type 2 diabetes is over that 6, 6.2, 6.4 range, depending on which labs, depending on what research you look at. But the point I'll make is most people in America today, and when I say most, definitely above 50+%, have either type 2 diabetes or are pre-diabetic, okay? Which means they're having problems getting sugar from the bloodstream into the cell, which is creating high levels of blood glucose, okay? And that's very damaging to the body. So we definitely want to make you aware of some ways that we could reverse that. Okay, so mechanism-wise, we eat those potatoes, we eat those starches, the pastas, the sugars, the flour-based products, the grains, our vegetables, our fruits, etc. That all turns into sugar or glucose in the body, in the blood, I should say. But what the body has to do is get that glucose from the bloodstream into the cell, okay? So we'll just use this as the cell that uses it for energy. And what happens is, if I have an elevated amount of glucose over a long period of time, months and months, years and years, the cell that accepts this glucose is going to become resistant. Because when I have high amounts of glucose, the pancreas also has to secrete a high amount of insulin, okay? And if I have too much insulin in my bloodstream over a long period of time, it's going to create resistance of that insulin. So it's called insulin resistance. So if glucose binds to insulin, and there's more to the story than that, but we'll keep it simple. Glucose binds to that insulin, and the insulin's trying to get that glucose into the cell, but the cell is resistant, then I'm not going to be able to get glucose into the cell for energy, and my blood glucose levels are going to rise. That, over time, is where we get pre-diabetic, and then if they rise high enough, those blood sugar levels rise high enough, I'm considered type 2 diabetic, okay? So again, type 2 diabetes is resistance at the cellular level for most of you, okay? Now, here's the deal with that. The insulin is the main issue. So too much blood sugar, right? We secrete too much insulin. Over time, that insulin, too much insulin creates resistance, okay? So I want to make sure you understand that. So that insulin, too much insulin, I should say, is a real problem, because that essentially is what causes the resistance, okay? So here's the deal. Once glucose is in your bloodstream, okay, it can't stay there, so the body has to do some things with it. Number one, it'll store excess glucose in your liver, okay? So that organ, that detox organ, also is responsible for storing glucose. So once I have enough glucose stored in the liver, then it's like a pool that's going to overflow. Think of a swimming pool with the rain we just had that is overflowing. That dumps into the bloodstream. Now the body has to get rid of that, so it stores it as triglycerides and fat, okay? So type 2 diabetics tend to have elevated triglyceride levels. They will also have fat around their belly, around the breast tissue, but they also will start to develop fat on the internal organs, which is called visceral fat, okay? So the fat stores can also lodge in your heart vessels, okay? So believe it or not, most people won't die of of diabetes. They'll die of heart disease or stroke, okay? Because the fat that is, let me back up, the glucose, right, that is in your bloodstream and then stored in the liver and overflows cannot stay in the bloodstream. So the body has to do something with it, so it stores it as triglycerides and fat. Okay, again, the fat can get stored around the waist, it can get stored in your breast tissue, but it also can get stored in your heart vessels, okay, which leads to high blood pressure, which could lead to a heart attack, and it can also lead to stroke. So basically a stroke is the plaquing that develops, the fat that in those arteries breaks off, travels around your bloodstream and get caught somewhere. It can get caught in your pulmonary arteries. It can get caught in your brain arteries, which leads to a stroke. Okay, so dangerous. High blood sugar levels are very dangerous. So that's the one thing I wanted to point out to you. Okay, so here's the deal. What can we do about it? So we know the mechanism. We know that we're ingesting too many carbohydrates, which turn into sugar, okay, or glucose. The pancreas has to secrete insulin to be able to get that glucose into the cell. Too much insulin, okay, over a period of time leads to a downregulation or a desensitization of that insulin receptor site. So basically, it turns into hard cement. So think of, we want the cell to be wet cement, which means it can be penetrated, right? So glucose can get into that cell. But if it starts to become hard cement, then we're not going to be able to get that glucose into the cell. That's type 2 diabetes. That's insulin resistant diabetes. Okay, hopefully that makes some sense there. Okay, now let's talk about some strategies that can help reverse it. Okay, two things that I want to mention as to why type 2 diabetes is on an exponential rise, in my opinion, but I think research clearly shows this as well. Number one, we're too sedentary. We don't move enough, okay? And number two, we eat too many carbohydrates. I think the last study I looked at, or research that I looked at, I believe roughly 65 to 70% of our food intake is processed carbohydrates, okay, per meal. So, which means that's processed sugar or glucose, all right? So if we're eating that way and not moving, we're prone to develop type 2 diabetes on a high level. And I believe that's what's been going on over the last 30 or 40 years. So let's break down some strategies that can reverse it. Number one, intermittent fasting, okay? Intermittent fasting means, and there's a lot of different ways to do it, but let me just highlight one of the ways to do it. We eat at, say, noon, and we stop eating around 6 or 7 at night. So we have a 6 to 7 hour window in which we eat. Within that time frame, we eat higher fats, we eat a moderate amount of protein, and a lower amount of low glycemic carbohydrates, okay, in that time frame. And then say from 6 or 7 at night, we fast, we don't eat all night, we go through breakfast, and we eat again around noon the next day. So we go into about, I'll say a 17 to 18 hour fast, which is going to help you tremendously as a type 2 diabetic. Here's why. Remember the concept of why we have diabetes. Our insulin levels are too high because we have too much glucose in the blood, right? So our insulin levels increase because of this blood sugar. What's going to help reverse it is if we go into a fasting state, we're going to get the glucose out of our bloodstream because the body's going to use glucose for energy in times of fasting when we're not eating, right? So around 3 to 4 hours after we get done our last meal, we'll start to use our glucose supplies in our blood. Furthermore, or as the fast lasts longer, we're going to start using our stores of glucose in our liver, right? So basically what we want to do is drain the swimming pool. Think of the liver as the swimming pool. We want to drain the glucose that's in that liver and empty it. When you're emptied from glucose from the liver, I say that right? When the glucose is gone from your liver, let's say that, the body's going to have to start using an alternative fuel supply, which will be fat. Okay, so you're going to start burning fat during this phase of fasting. Now, more important than that, or as important, I should say, what's going to happen is you're going to decrease your insulin levels because glucose is going to be super low or non-existent during the fast, right? So if I have low levels of glucose in my body, okay, you don't need insulin, right? Remember, glucose piggybacks on insulin to get into the cell. So again, if I have low glucose, I have low insulin, and we need that low insulin over a long period of time because it will start to change the receptor site from hard cement to wet cement. So the whole idea is we want that receptor site to start changing and becoming more sensitized, okay? So I'll use a quick example. If I drink a cup of coffee, 6-ounce cup of coffee, I'm gonna feel a jolt from that. Most people will, right? But if I keep having that same cup of coffee consistently day in and day out, what's gonna happen is I'm going to need more coffee, right, to get the same effect, because the caffeine, right, that's in our body consistently, the receptor sites that it works on is going to become a little bit tired because it's always there. So think about this. If I stop drinking coffee for, say, 3 months and then had a cup of coffee again, that 6-ounce cup of coffee now will create that effect, that positive effect that we look for. But if it's there consistently, it won't do it. You'll start to need more and more. And that's exactly what happens with the insulin. As we get more resistant, we need more and more insulin to get the same amount of glucose into the cell. So again, think about the opposite of that. If we're fasting, we get the glucose low, and then the insulin starts to get lower and lower, and because it's not needed, right? Not needed if we have low glucose, which is going to start waking up the receptor site. So intermittent fasting is a huge need for patients with type 2 diabetes because it will start to wake up the receptor site, okay? Because we're reducing glucose and insulin. All right, hopefully that makes some sense. Number 2, to put that process on steroids, if you will, we need to exercise. We need to move, okay? So there's a form of exercise called high intensity short burst training, okay? That is, roughly speaking, the minutes anyway, I should say, studied, researched, that you only need about 7 to 10 minutes of high intensity short burst training to get physiological benefits from it. Major physiological benefits. Number 1 major benefit, it helps wake up the receptor site. So if I get my heart rate up, and I'll explain this in just a minute, to a certain level in what they call the intense range, and I keep it in the intense range for 7 to 10 minutes, I am going to physiologically help my body wake up the receptor site. And in turn, along with intermittent fasting, I will help wake that receptor site and help reverse type 2 diabetes, okay? So let me talk about this high intensity training, because there's also an anti-inflammatory effect. There's also the ability to increase growth hormone. You have the ability to help your adrenals or your cortisol levels, which is a huge factor in type 2 diabetes, etc. So the high intensity training is a key for patients that want to reverse this type 2 diabetes. Basically, and it gets a little complex, but and I don't want to go through the formula now, but I do want to say this. High intensity basically, well, I guess I will go through the formula, is the number 220 minus your age, okay? You get a number. So say I'm 20 years old, I'm not, but say 20 years old, 220 minus 20 will give you the number 200, okay? So 220 minus your age, you could put that number in there, and then times that number by 0.75, okay? So you want 75% of 220 minus your age. Okay, and that'll give you a number. For me, I'm 49, so somewhere in the 130, 140 range, 220 minus the number 49, you get a number. I times that by 0.75, and I might be in that 135 range, okay? You could also, as you get better at it, times it by 0.8, 0.85, 0.9. Basically, all you're doing is taking a percentage of the 220 minus your age, and that's going to give you the number of beats per minute that you want to stay in that range, okay? So for me, again, I'm up at the 85, 90 percentile of my number. I'm going to work in the 155 to 160 beats per minute range. Having said all that, okay, the easiest way to tell if you're getting intense exercise is if you're exercising and you can't talk to the person next to you, right? So I'm exercising, oh, hang on, I'll talk to you in a minute. That means pretty much, without doing all that math, that you're in that intense range, okay? So that intense range for 7 to 10 minutes is proven to be as effective as 30 minutes of high intensity exercise. So really, you just want the physiological benefit of trying to wake up that receptor site, and that intense exercise is going to do it. Now, having said that, another form of exercise is going to be needed long term. So many of you with type 2 diabetes also have extra cellulite or fat, right? So what we want to make sure that we do with low resistance right? Light resistance, which is lightweight, high repetition training with what they call functional movements, is we want to be able to transfer, right, your fat into lean body mass. The only way you're going to be able to do that is with light resistance training, okay? Because we want to develop more lean body mass. So if I'm intermittent fasting, I'm going to start burning fat, right? If I'm doing the high intensity plus intermittent fasting, I'm going to start to wake up the receptor site. Okay, so I'm going to be able to start reversing this type 2 diabetes. If I want to maintain that long term, I have to start developing a little bit more lean body mass, because muscle burns calories twice the rate as fat. Okay, and fat is also going to be a contributor to type 2 diabetes. The adipocyte, or what are fat cells, contribute heavily to type 2 diabetes. So we need to do some strategies here that are going to help burn some fat and change that fat into lean body mass. So those three strategies, intermittent fasting, high intensity short burst training, 7 to 10 minutes, and resistance training, are proven to be able to reverse most type 2 diabetes, okay? Now, there's a caveat to that. I do have some diabetics that eat real well, that are very thin, right? Very athletic. And what we found is there's also some other mitigating factors that could create type 2 diabetes beyond just the sedentary lifestyles and eating too much sugar. They could have inflammation. They could have infections driving the inflammation, because inflammation in general will reduce or desensitize the receptor site as well, okay? So inflammation can also lead to type 2 diabetes. So with a patient, we need to go through and check a lot of different things to find out, number one, what type of diabetic they are. Are they type 1, type 2, 1.5, type 3, right? If we're type 1, it's very difficult, if any, to reverse that. That's an autoimmune condition, and the immune system will attack the pancreas. Now, there is some evidence that if we work through the fuels to that fire, we work on the immune system, etc., that can be possibly reversed. But type 2 definitely can. And then if you have type 1.5, which is type 2, and type 1, it gets a little more difficult, okay? So when I personally assess a person, I need to do certain labs, right? The labs that I do are your fasting glucose, something called hemoglobin A1C. I do fasting insulin, and I do C-peptide, okay? Those labs, will help me determine what type of diabetes you have. Okay, it's hard to get into explaining each one of those, but that's the assessment that we want to do. We could also test antibodies against your pancreas, which tells us if you're autoimmune diabetic. Okay, so and then if we're working through and we find out that you're a type 2 diabetic, then we start working on the intermittent fasting, we start working on the high intensity exercises, we start working on your resistance training, and we help you through each one of those steps. And then we also have to look at inflammation, infections in the body if you don't fit that mold. And I would say roughly 85% of the patients that I see, maybe more, are type 2 diabetes because of their eating habits and their sedentary lifestyle, right? And then some of those also have inflammation that we have to work on to help wake up that receptor site. Some of them have copious amounts of stress, right? So stress, the fight or flight constantly, is going to increase something called cortisol. Cortisol is going to shift you fat storage from fat burning. So we have to look at your stress levels as well. Sometimes your cortisol levels, pregnenolone, DHEA, things like that. So we have to get into looking at those with some patients as well. So we have, beyond the intermittent fasting, beyond the HIIT training, the resistance training, we may have to look at inflammation, we may have to look at your stress levels, we may have to look at your gut, your digestive system can play a factor, your liver and how your liver is functioning, we may have to get into that as well. So the point that I'll try to make in summary is that we can definitely, with most type 2 diabetics, reverse, okay, I'll say it again, can reverse their type 2 diabetes. We've done it multiple times personally over my career. I've probably done it hundreds of times, okay? But there's a there's a formula that needs to be followed. It's not just here, take this, unfortunately, right? It's not an easy way out. We have to go through these strategies and this formula. If the formula is applied properly, and as a clinician, myself or whoever's working with you, do the right things and look at the right things, and then put a plan together, there is a great chance to be able to reverse the type 2 diabetes. But we have to find what's causing it, right? We have to identify those. We have to do the right lab test. We have to go through the process of a checklist and find out how you and your symptoms apply to that checklist. If we can do that, we just start checking things off the box. We clean things up, and all of a sudden the numbers start to go in favor. We're down below 100 on our fasting glucose. Our A1C levels are below 5.6. Our insulin is normal. Our C-peptides are normal, and we're good to go. So again, I know that's a lot. Okay, if you need help, call the clinic. Come in. You can see us. You can see me at any time. And I can help walk you through this step-by-step process and guide you through the labs that need to get done, and then also find out if there's any of these other, causes that could be contributing to your diabetes, your type 2 diabetes. Okay? I know that's a lot. I hope that was helpful. It gives you some insight. If you need to go back and rewind and watch this video several times, you always have that opportunity. And if you need help, just call us at the clinic, 949-680-1880. Dr. Roney, I'm here to help you in any way I can. Okay? Have a great day, gang.